Amylmetacresol is an antiseptic used in the treatment of infections of the mouth and throat, such as throat infection, throat discomfort, mouth infection, and other related conditions. It works by killing the bacteria that affect our growth during mouth and throat infections. Amylmetacresol is often combined with dichlorobenzyl alcohol and menthol in the commonly used sore throat lozenges. Indications: sore throat, minor mouth and throat infections. How to use: recommended for adults and children over 6 years of age. When the first symptoms of inflammation appear in the oral cavity and pharynx, it is recommended for adults 1 tablet every 2 hours. The maximum daily dose is 8 tablets. Children over 6 years old 1 tablet every 4 hours. The tablet should be sucked until completely dissolved. Contraindications: hypersensitivity to any of the ingredients. Warnings: not to be given to children under 6 years. If symptoms persist, have not improved, or have worsened after 3 days, consult a doctor or healthcare professional. If you have food allergy different from celiac disease, you should not take this medicine. Overdoses should not present a problem other than gastrointestinal discomfort. Treatment should be symptomatic. Side effects: sedation, sleepiness, fatigue, vomiting, weakness, dehydration, dizziness, lightheadedness, headache, sweating, anemia, nausea, edema, swelling, constipation, dry mouth,